This is my presentation on health concerns for the population that have ADHD. So kind of a description of the population. Attention deficit hyperactive disorder is a neurodivergent disorder in which individuals have difficulty paying attention, they have a hard time sitting still, they're extremely impulsive, they have a hard time with organization, they have poor time management skills, they have frequent mood swings, and they have a lower ability to cope with stress. So dopamine dysregulation actually causes the brain's need for constant stimulation, one of the reasons why they have a lot of these symptoms. So the size of the population, I noticed locally in Davis County, there's not really much significant data. In fact, I couldn't find anything for Davis County. Statewide, about 6.7% of Utahns have ADHD, 9.4% of children are estimated to, and 2.4% of adults in the US. Internationally, there's about 2.5 that are persistent adult symptoms. The ones that are actually symptomatic are about 6.7% global population. The population in Utah is smaller per capita than the nation, and this could possibly be due to elevation. So there was actually a study in an article from the University of Utah that states attention deficit disorder and ADHD decrease substantially as altitude increases. So Salt Lake City, that has a elevation of about 4,300 feet, they noticed that the diagnosed ADHD prevalence was about 38% less than at sea level. Some social determinants of health are the education access and quality. So social discrimination and their inability to actually concentrate affects the way that they learn and retain information. It's harder for people with ADHD to retain information, and that reflects on their grades and also their schooling. And some children with ADHD will actually not even go to college or complete high school education. To a lot of their symptoms, the population's at risk for unstable relationships, difficulty in school or work. They have lower self-esteem and other issues that interfere with their daily life and function. Some specific concerns that are contributing factors is you can get ADHD from a brain injury or exposure to environmental risks such as like lead poisoning during pregnancy or even at a young age, alcohol or tobacco use during pregnancy if there's a premature delivery, if the baby was a low birth weight, and then also parents who have ADHD are more likely to pass that on to their children as well. Some root causes. So kind of going down the list of why people with ADHD have a harder time focusing and remembering. Why do they have a harder time? They have a hard time because their brain isn't functioning properly. Why is it not functioning properly? Because the neurotransmitter dopamine is dysregulated, making it harder to be normal. So Maslow's hierarchy of needs that are met, I would say the physiological needs are met, and those are kind of like just your basic needs. The needs that are kind of met but also unmet depending on their situation at home and also their peers and family would be safety and love and belonging. They can be compromised depending on the severity of their symptoms. If the symptoms are severe, then there's the risk of injury to themselves. They also have the inability to maintain their employment, and it compromises their safety. Depending on how their family and peers interact with them as well can be affecting the love and belonging. They maybe not feel safe and therefore can't be able to feel love and feel like they belong either. The needs that aren't met are esteem and self-actualization. Esteem is compromised both personally and socially. With the affected esteem level, self-actualization can't really be established, or it would be poorly established since that's kind of a pyramid shape. It depends on the lower bases being the stabilization. ADHD can also cause an increase in anxiety and depression, and people often function without higher levels of Maslow's needs. They find a way to cope and adapt, and can often get by without much of the levels above. Safety, but not for very long. Some anticipated functional level, I would say, since the physiological needs are met, they can usually function without the other ones, but the optimal functioning level would be about love and belonging or even esteem. Some likely health outcomes would be the risk for depression and anxiety, some poverty because of unable to hold down a job, poor health and sleeping disorders, and eating disorders or lack of nutrition. Some communicable diseases or infections. So they are at risk for communicable diseases due to the lack of education, or even they didn't finish education from school, can result in the population being at risk because they don't have that base knowledge. They don't really learn exactly where diseases come from or how to prevent them, so they're going to be more at risk. Also, due to lack of nutrition and sleep, the immunity can be compromised. So some possible diseases that can be transmitted amongst this population would be like respiratory diseases like flu and COVID, also STIs because they're not having that sexual education, learning about what to prevent, hepatitis, and encephalitis. Some non-communicable diseases. So there's diseases that occur secondary to symptoms of ADHD, which are mostly like anxiety and depression. It can cause cardiovascular disease, diabetes, cancer, and other respiratory diseases as well. And also mental health itself, like the anxiety, depression, and other mental disorders. One of the articles I read was integrating mental health with other non-communicable diseases. It talks about how mental health and other non-communicable diseases should be considered a multimorbidity. So they're closely related to one another when it comes to overall health. So mental illness can cause chronic illnesses and vice versa. Some self-care, self-harm, or harm to others or by others. So this population is at risk for self-care deficits and self-harm. With their poor time management comes the lack of self-care. They get distracted, they don't remember to eat, they don't remember to pee, they don't remember to shower. It can be neglecting themselves. Also, the inability to focus and becoming easily overwhelmed increases their risk for depression and suicide. The population can be a risk to harm others. It's not necessarily a big thing. I didn't find much information on this. And they can be harmed by others, which mostly includes being bullied or even ostracized. But with their easily being frustrated and their impulsivity, it can risk them lashing out, which, I mean, if you're younger, you can get in fights. These issues can be mitigated by finding these symptoms early, getting them the treatment or even education to themselves early before it starts to become detrimental to these people. Also, educating families and peers of how to approach and handle people who do have this mental illness, so it kind of makes it easier for both parties. That can help it before it's becoming too detrimental for them. And my references.